Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 32 new cases of COVID-19 in Windsor and Essex County. Of the 32 cases, 1 is outbreak related, 14 are close contacts of confirmed cases, 9 are community acquired, 1 is travel related outside of North America, and 7 are still being investigated. We have had 12,931 cases since March of 2020. 12,291 cases are now resolved, and 261 people are active at this time. 47 confirmed cases are currently in the hospital, and 5 people are in ICU. Our community has lost 379 people to COVID. Unfortunately, we are reporting an additional death today. A gentleman in his 70s from the community. 236 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 12 active outbreaks in Windsor and Essex County, 3 in long-term care and retirement homes, 2 community outbreaks, 5 workplace outbreaks, and 2 hospital outbreaks. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. 11,528 individuals from Windsor-Essex County have now received both doses of a COVID vaccine. Following our announcement yesterday that we would be starting to immunize our seniors 80 years and older, we provided information on how to pre-register for the vaccine. As of this morning, we had approximately 8,400 submissions. Please note, this represents all submissions. Currently, we have 7,000 people who have identified they are 80 years and older and will be included in the randomized selection process. Our epidemiologists are currently reviewing the information, removing duplicates, and preparing the selection process for Monday's clinic, which will occur today. People will receive calls today and over the weekend, informing them of their appointment. Our pre-registration system is on our website, and people also have the option to call our phone number, 519-251-4072. While we encourage as many residents as possible in this age group to work with friends and family to access our website to complete the pre-registration, we do recognize the challenges that may be involved. So those who cannot go online, please feel free to call. However, you may have a little bit of a wait time. Yesterday we did an average, there seemed to be an average wait time of approximately 25 minutes. So based on that, we still encourage everyone to visit our website and our vaccine webpage for further information at wechu.org, wechu.org, and click on the COVID-19 vaccine button. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. I'll just go straight into our epi summary, recognizing that we have lots to cover. So very quickly, starting all the way from the top, what's the situation globally? As we can see that pretty much everywhere the cases are stabilizing and in the downward trend, and Canada continues to be in the downward trend. And among the selected countries, our daily case rates are much better than the comparators. Similar picture when we're looking at the number of deaths, and every country is seeing a good decline in the number of people who are dying, and again, similar trend where Canada is doing much better than some of the other comparator countries. Focusing in just the province of Ontario, we have seen that the trends and the numbers going down for the province, but we are seeing a slight indication that there may be an increase in the number of cases in the province, which is still something that is of concern when we are talking about some of the other variants that are being found in other parts of Ontario. Focusing in Windsor-Essex, similar trend. We have seen a sharp decline in the number of cases. We have seen a little increase, partly due to the outbreak that we are seeing in the shelter system, but then we're again seeing some stabilization of our cases as we continue to move forward. Our 7-day comparison with respect to Windsor-Essex and Ontario, overall following the similar pattern, but generally our rates are better than the provincial average that we are seeing. When it comes to cumulative cases of across Windsor-Essex, we are starting to see the flattening of the curve with the cases stabilizing in our region. More recently, we have seen a steep increase, but it seems to stabilize right now. With respect to cumulative deaths, we continue to see people dying in our region, and that includes not only the people who are in our long-term care home, but also in our community, and that is one of our concern. And as the vaccine continues to roll out, we want to make sure that we are providing that level of protection to the people who are living in the community based on their age. Looking at week-over-week case rates in Windsor-Essex, we have seen that we've seen some ups and downs more recently in the last 3 weeks. In the last 7 days, our case rate is 47.8 per 100,000 population. This is a decrease from last week when we were at 58.1 case per 100,000 population. Looking at our rate comparison with respect to Southwestern Ontario and the province, we're almost similar to where we're slightly better than where the province is, and slightly worse than where the Southwestern region average is. This is the data that that is still in the analysis phase and the development phase, and what this data shows is the presence of SARS-CoV-2 virus in our wastewater system. And using the methodology, what we are trying to align is the presence of the SARS-CoV-2 virus in the sewage water, and to see how it relates to the case counts in the region. So looking at the trend overall, we have seen that all these numbers have declined significantly, but now in the last week we have seen a small spike, hoping that these are all part of the learning rather than seeing a trend moving in the opposite direction with additional cases in the region. So something that we need to really be mindful of, and as we know that these SARS-CoV-2 virus tends to appear a little bit earlier than what the actual surge would look like. So we'll continue to monitor, but again, these are all still in the analysis phase, and but the result of this analysis should be interpreted with caution. Looking at our person positivity by week over week by all the tests for COVID conducted in our region, and in total we have 272,804 tests that were completed up as of February 20th, and this is a complete week that ended on Saturday. What we are looking in that week timeline, our person positivity of all the tests that are coming back in the region with unique individuals is 2.3%. Looking at our person positivity at the most recent 7 days, again, this is a preliminary data. This doesn't include the full week data. Where we are at is we are sitting at 3.2%, and again, the difference between the last slide and this slide is the last slide used all the data based on the week that ends on Saturday, and this is just the last 7-day moving average, which is at 3.2%. Breaking that person positivity down by age group, we can see is they're all coming pretty much close to each other, all the person positivity in each of these age bracket, with a slightly higher person positivity in the younger population, as we know that generally the younger population doesn't get tested unless they have some symptoms. Our person positivity by the forward sortation area, and we can see the darker the shade is, that means that we are seeing more higher person positivity of tests coming from that region. We have some pockets of region with a slightly higher person positivity between 5 to 10%, while majority of the region is less than 2%, and with some region between 2 to 5% of person positivity. This graph looks at the percentage of test results that are available within 1 and 2 days of someone getting tested, and as you can see, approximately 43% of the tests that are being processed with the results available within 1 day of being tested. And then within 2 days of being tested, 90% of tests are being processed with the results available. So this is pretty good for our region, especially the 2-day. 1 day, I think we can do better, but when we're talking about within 48 hours, the number is pretty good, 90% of the test results coming back. Looking at our percentages of test result that is available within 1 day, and on an average, we are in the last third of all the region in the province that are getting their test results within 1 day. So we can do better. That most of our tests can come back in a short period of time compared to the provincial average. Number of days to receive test results, starting again from when a person is tested, and then they get the test results back. It currently is at around 1.6 days, which makes us being in the middle of the pack. Looking at our over regional and provincial rates that started all the way from the first case of COVID-19 in our region all the way up to here, we can see we are still at the second highest rate of COVID cases in Ontario. Breaking these case rates by municipality, this is a cumulative picture, no surprises there, with majority of the cases in Leamington, Kingsville, followed by Windsor, and the rest of the municipality. But in the last month, starting from February 1st, we have seen that the majority of cases are from Leamington, followed by Windsor, and then Tecumseh and Essex, followed by the rest of the region. Overall picture, we know half of the cases are in Windsor. And then in the last 7 days, what we have noticed is the majority of the cases, almost close to 80% of the cases, are from Windsor, while the rest of the municipality had a smaller share of the cases in the region. Breaking it down by age and sex distribution, no major change, except in the last 2 weeks, what we have seen is an uptake in the number of cases between the ages of 50 to 80 years of age, which is slightly higher than the previous or overall distribution, age and sex distribution of the cases in the region. This graph looks at the non-epidemiologically linked cases in simpler terms, if the cases are acquired in the community or where there is no source of exposure. Based on a 7-day moving average, we are seeing that 22% of our cases do not know how they acquired the virus. That's almost close to 1 in 5 individuals in Windsor-Essex still don't know how they acquired the disease. Overall, looking at the exposure rates, we can see a good mix, and then just focusing very closely between February to present. It's spread pretty much all over, with the majority of the cases between the household contacts and close contacts, and we're still seeing the bars in the red, which is the community spread, and that means that the virus is circulating in the community, and all these precautions and everything that needs to be happen in place. Acquisition sources by municipality. Again, no major surprises. We can still see some travel-related cases in at least a couple of municipalities, and then the rest of the cases are distributed between the household contacts, and we can also see some of these cases in each of these municipalities linked to the outbreak that we have seen in the region. Overall, as of February 25th, we have 12 outbreaks that are currently being followed by the health unit, and this is stabilized from last week. We're starting to see the outbreaks being rescinded in many of these long-term care home and retirement home, which is a great sign, because most of these homes now have residents have received more than 90% of the residents have received full 2 doses of vaccine, and we hope to continue on with the rest of the priorities as we have been doing since the arrival of vaccine in our region. Hospitalization and ICU data, we're starting to see a slight increase in the number of hospitalization, but the ICU cases have declined and remain low in our region. Admission day by day for COVID, we have seen a slight increase in the last few days, something that we need to be mindful of, and we'll continue to see how it results in any further severity of the disease. Looking at our acute and inpatient occupancy, The hospitals are working at pretty much at capacity at this time. ICU occupancy, similar picture for the ICU beds. It's close to 90%, which is pretty high. And then the adult vented ICU capacity is close to 50%. Overall, since the beginning of the pandemic, 95% of our cases have resolved, with 2.9% or 3% of these cases who acquired disease in Windsor-Essex unfortunately died, and roughly around 1.3% are currently self-isolating. This graph breaks down the death from the beginning of the pandemic onwards by each of the day reported. And as we can see that overall we are seeing a decline in the number of deaths, but we definitely like to see that number goes down to zero. That's the hope, and we'll continue to provide the necessary support and protection for our community to prevent all these deaths. Looking at the age and sex breakdown of COVID-19 deaths in our community, overall slightly more female died with COVID diagnosis compared to males. And from an average distribution, from an age distribution perspective, 64% or 2/3 of our deaths in the region occurred in individuals who are 80 years and older. And that's a big number, and especially when we are rolling out the vaccine in that age group. That's exactly for the reason that majority of the deaths are happening in that age bracket, and we want to make sure that we are providing the level of protection that they need to save their lives. Overall, our case fatality rate is slightly higher to that of Ontario, but when we are comparing with the long-term care home, or when we are comparing ourselves with the community cases we're dying, those numbers are presented here. Our day-over-day doubling times continue to be slightly better than Ontario and Canada, but as we know, it can fluctuate and it can change very quickly. Our median, most recent estimated median R0 is 1.03, and this is a decrease from last week, which was at 1.14. And we talked about it when R0 is greater than 1. Every infection is causing more than new infection. So still hovering around at 1, which means the cases are not in the decline, but maybe still at a stable rate. So in summary, our case rates in Windsor-Essex has decreased slightly. Acquisition source is still all over the place, like including household contact, close contacts, outbreak related, and as well as the community transmission, which is at every 1 in 5 cases. The hospitalization has increased, so we'll have to be mindful of that, but overall at this time the ICU admissions have decreased, but we know that some of these hospitalization could very well lead into the ICU admission, and could eventually lead to some people dying as well, so we have to be mindful of that number. The number of outbreaks in the region continue to remain unchanged, and we are seeing a lot of improvement in the long-term care home and retirement home with the outbreaks and the cases decreasing in that population. Our day-over-day doubling time in Windsor-Essex is slightly better than Ontario and Canada. With respect to the monitoring indicators, our most recent 7-day case rates is right now 47.8 cases per 100,000 population per week. Our person positivity, which if we include the full week, which ends on Saturday, we are at 2.3%. And then with the most recent 7 days person positivity is at 3.2%. But again, that number is subject to change because when the week ends, that number changes. So we just want to caution that this is something that can change over the time. The median R0 effective is 1.03 at this time, and as at the bottom of the slide, I put the criteria for red control when our weekly case rates are more than 40 or more 100,000 population per week. So we are slightly above that. With respect to person positivity, we are slightly better. With respect to R0 effective, we are slightly better. So the critical criteria for all of these indicators has always been the case rates, and our case rates are higher than that. I haven't had any conversation with the province, so my assumption is we'll continue to stay in the red zone at least for another week. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning. So I guess you just said that looks like we'll be staying in the red zone. What would it take to get to the orange level?
So our case rates has to go down then less than 40 cases per 100,000 population. I think our percent positivity is in that range. If we are looking at the full week data, and our effective is in that range as well. So the only insignificant number is our daily case rates in the region, and also what is happening outside of these indicators, such as the health system capacity, public health capacity, as well as any significant outbreak in the region.
Are you confident that the region will be able to move in that direction in the next few weeks or months?
Well, I hope so. We definitely want to see us moving into a better zone, but it also mean that we are not seeing any significant concerns with the spread in the community. We know that we have been in the lockdown for quite a long time. We are in the red zone with things opening up. We're seeing a case like every day. I think we're reporting between 30 and 40 cases, which is slightly increased from some of the last week when we reported cases in the 10s or in the 20s. It's not getting, I have to be very careful what I say. I wouldn't say that we are doing very, very well. I think we're doing okay, and we still need to move slightly better zone to feel more confident that we are not putting the community at risk by moving too quickly, especially when we are talking about the variants of concern that continues to spread in other regions.
And changing gears a little, where will the migrant workers fall in the vaccine priority queue, and will they be getting earlier access to the vaccine to help avoid some of the outbreaks that we saw in the area farms last summer?
Well, I think the majority of these prioritization comes from the province, and what we are seeing from the provincial direction is very clear in what they have identified. For my region, as I reported earlier, people who are dying are in the 80 plus category, and 96% of our death happen in individuals who are older than 65 years of age and above. That's my priority at this time. The provincial priority, we'll have to wait and see where they are landed there. Me and my team is committed to ensuring that we are distributing the vaccine in a fair and equitable way, and also making sure that the population that are severe, that are getting the most severe consequences of COVID, they are protected the first. So we'll continue to work with whatever vaccine we are getting and continue to work through the priority that's provided to us from the ministry.
Okay, great, thank you.
Any questions from CBC?
Hi, good morning, Dr. Ahmed. Good morning, Teresa. Dr. Ahmed, I know you mentioned AstraZeneca recently, and I believe it was yesterday, and now that product has been approved. I'm wondering if you have any specifics on what effect the approval will have on the vaccine rollout locally, and if you've had any conversations with the province about what kind of supply we could see of that product when it comes online.
All great question. Unfortunately, I don't have lots of answer. The only comment I can say is really excited to see, and that was my reaction to when Mike shared that news with me. So it's a great news that we now will have access to a more fridge-stable vaccine that will be easier to mobilize and easier to target and to take to places where the cold chain maintenance had been an issue in the past. So we are definitely excited. We don't know what the rollout would look like, what kind of vaccine that we will get in our region, but definitely that opens up more possibilities to roll out the vaccine. We'll have to wait from the province and the feds to really look at what the supply would look like, and if there's any specific criteria or indication for that population, we would definitely be interested in taking that vaccine and administering it in our community.
Thank you.
Any questions from Blackburn?
Yes, I have a couple from the community, actually, just piggybacking off of questions I asked 2 days ago regarding families with disabled loved ones. The first one is, can families in the community that are caregivers, that is, they're taking care of their loved ones who are disabled, apply for the vaccine under the registration right now for those caregivers?
So what I can tell you at this time is it's a challenge because those who are registered with the home and community care to receive care at home, they are identified as a priority in the provincial framework, and they are working the home and community care. Our team is working with the home and community care to get access to that list and to work with them to on a rollout plan. Those individuals who are above the age of 80, they will be included in what we are doing right now, and we're also looking at it. But if you are a caregiver who is not directly affiliated with the home and community care, getting access and getting the accuracy of the information is a real challenge, and there is no mechanism and system for anyone to verify that information. So as much as I really appreciate that these individuals may need the vaccine on a priority basis, but right now with the limited vaccine supply and not having a good system in place, they'll have to wait until we get to a better place where all of these things will be sorted out to make sure that the vaccines are going to the right people. And I cannot emphasize that more, that it weighs heavily on me and Teresa every time when we're talking about these vaccines. We want to make sure that it goes to the right people, and we want to make sure that we have got a good system in place, and we have said that, expressed it locally as well as provincially. The ability to verify and the ability to ensure that we are protecting the right people who are impacted by it needs to happen in a very, very quick and fair and equitable way, in a manner that everyone can understand. We don't want anyone to misuse that opportunity to jump the queue just to get the vaccine. When we are opening up the 80+ category, it's simple. You have your ID, you are 80+, you get the vaccine. There's nothing more that we need to do to make sure. We also know from the data that most of the people who are dying are in the 80+ category. So that's a very clear and simple example of how it can be implemented. I really hope that we don't have to go through that level of details in prioritization, but unfortunately, with the very limited vaccine, we want to make sure that we are doing the right thing, and these individuals have to wait for now.
Okay, and maybe this might be even the same answer, but I'll ask it because it was a separate question. 3 or 4 families in the region are living with caregivers taking care of their disabled loved one that are they have a foreign caregiver permit, but no OHIP number. Can they apply, or are they going to have to wait too?
So I'm not sure that how they would be classified. So if they will be classified as a caregiver, I don't think so, because again, there is no way for anyone to verify that they are the caregiver, and we don't have a system in place. I may have to take it back to our provincial colleagues as well if there is a significant number of these type of people, that how they can be prioritized or they will be included in that number. I don't have an answer at this time, unfortunately. Sorry.
Okay, thank you very much.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Doctor, what impact, if any, has the outbreak among the local shelter population had in either keeping our case rate where it is or preventing it from dropping further?
So I think we are seeing a stabilization of cases in the shelter population, and so we are keeping a very close eye on that number. What the numbers we are reporting right now, and Teresa reported, I think at least 10 of these cases that we reported today are linked to the outbreak. So that's, I'm not sure that if all of them are linked with that outbreak. I think at least 2 or 3 are linked, but again, I get those details later during the day. Overall, I think the challenge is with the population. So, and I'll let maybe Teresa
No, one was related to the outbreak.
One was related to the outbreak, yeah, okay. The challenge with this population and this outbreak management is most of these individuals, as you know, they were living in the shelter with access and mobility to various places. They are not the one who are isolating at all times, and there's no way to make sure that if someone is symptomatic, whether they have a positive or not. So it does pose some risk to the community, but we're hoping that with all these support system and wraparound services in place, we'll be in a position that we don't have to worry about it. At this time, I think we're still seeing the majority of the cases that are not linked with this outbreak, but linked with the community, what's happening in the community, and hoping that that number will continue to go down as we have seen in the past. But I just want to remind everyone that, you know, we like these numbers to go down, and we want people to continue to follow these measures, as despite the fact that we are opening up and we are having more opportunities, the public health measures continues to be in place. So please follow that so that we can continue to get to in a better zone with more opportunities for everyone, with more business, economic, social, mental well-being opportunities for everyone.
And the long-lasting outbreak at Village at St. Clair has now been rescinded. Can you comment on that outbreak in its entirety? I mean, more than 300 cases, 63 people died of COVID-19 there. Can you reflect on that outbreak?
Well, I think the initial reaction that when we saw the rescind request, when my team compiled all that information and presented to me for the rescind, it was really exciting because we've been monitoring that outbreak, and even though in the last month or close to a month, we started to notice that the cases are not increasing, but we were still seeing one or two occasional cases, which was prolonging the outbreak. It was the worst outbreak, I think, in our region that we have seen, and it was unfortunate that so many people lost their lives there. And there are a lot of work that we have done. There's a lot of work that our health system partners, more specifically Hotel du Grace Healthcare, they went in, they took on some of the leadership role to support the home, and a lot of work that was done to do that. But overall, I think as the sector, long-term care home, I hope that all these learnings will provide some better systems in place to protect our most vulnerable in our community. But this is again an exciting news to at least that they are no longer in outbreak. And any homes in our region, again, my message is going back to the same. Yes, they are protected. Many of these individuals are now received their vaccine, but public health measures still need to be in place. Public health measures should always be followed, and that's the only way we can prevent it from getting worse again.
Finally, Teresa, about the vaccine scheduling for the 80+ age group. Once you've scheduled people for this week and then in Windsor and Leamington for the following week, will you continue to schedule appointments knowing that there isn't the supply of vaccine in the region to complete those?
So we're having a meeting today actually to talk about how far we're going to book, because we know that with the Pfizer vaccine that second doses have to start at 21 to 27 days. So we are having those discussions internally, and we'll have a better idea, shortly about how far we're going to go out with the site in Windsor and with Leamington, because we want to accommodate second doses and just have a better understanding of how this will look, and and also get more information about our vaccine supply. So maybe things are changing all the time, but as you know, we're using very limited Pfizer right now, so we'll see what that means in the future. But for the next couple of weeks, we know we have very limited supply.
So if a senior doesn't receive a call to book their appointment, they shouldn't be concerned.
If they receive a call to book their appointment, they will get their first and second doses. So we'll ensure that they'll, and so for Monday, we're going to have a little less people. We'll probably book around 150 people, but So today and over the weekend, 150 of all the people that have re-registered are going to get a call from someone to say that they are scheduled. So we'll just move forward and, you know, populate all of the available spaces and go from there.
Thank you.
Any questions from AIM 800?
Teresa, you mentioned as of this morning, 8,400 have pre-registered, and then you said 7,000. Is that 7,000 eligible? So there's 1,400 that shouldn't have pre-registered. I just want clarification, if that's okay.
Yes, so I talked to our epidemiologist. 7,000 are within the over 80 age group, so they would be eligible, and others have pre-registered, but they wouldn't be part of this selection. So I think, I don't know how it all, you know, how it's all broken down, but when I checked in with our epi this morning, he said that the others would not be eligible at this time based on the birth year. So they're in the system as pre-registered, but not in the group right now that will be used for the randomization and the appointments.
Okay, thank you. And then with the 8,400, were you expecting numbers like that, or were you expecting more? Because I believe you said yesterday that population has around 20,000.
The population has around 20,000, but I believe that includes the over 80 in our long-term care and retirement homes as well. So it wouldn't be 80, or it wouldn't be 20,000 in the community that would need the vaccine. So it'll be less than that. But no, within an hour of I believe it went live around 1, and within an hour we had like close to 800 people already pre-registered. So we were like surprised that was so quick. So I think the media did a great job in getting the word out, because, you know, it went up quickly, and, you know, everyone was very busy. But yeah, I think that's pretty impressive to get that many. You know, 7,000 it's wonderful.
And I know Adele touched on this yesterday, but if you can just repeat, when it comes to the 150, 200 day that you're hoping to do, that's all based on current vaccines that we have in the region right now. That number can obviously change if we get more vaccine, but as of now, that's the target goal, between 150 and 200 people per day?
Yes, and that would be, so initially it'll be at the one site and in Windsor, and then on March 8th, we'll do the same amount at the Leamington site. So it would be between, it would be 200, you know, in Windsor and 200 in Leamington, like that. That's kind of what we're scheduling for. And then we'll see what happens. I know the vaccine, we only know for the first couple of weeks in March right now what our allocation is, and like, you know, March is on Monday, so we'll have more information, but right now that's the most we can do.
Thank you.
Any additional questions from CTV?
No, thank you.
CBC?
Yes, just one question for you, Teresa. I know you touched on accessibility yesterday and how the site is open to people who are able to get there. I'm wondering, since registration has opened yesterday, have you heard many concerns from people who are unable to get to, will be unable to get to either site because of disability or other reasons?
I'm not aware. I'm sure that I'm looking at Mike, because he would have more of a.
We've received some concerns about people with mobility issues and not being able to attend.
Yeah, so Mike is saying that we have received some concerns about people with mobility issues that won't be able to attend. And I think yesterday I did say that this isn't, going to be for everyone at this point that are over 80. It is a limited supply of vaccine, and it's, it may not be the best option for everyone. we continue to try to work internally about what other options are available for our seniors over 80. So, you know, as we're able to, we'll try to open it up and give people a little bit more ability to access the vaccine. But right now, it will be limiting for those that have mobility issues outside of a wheelchair or a walker, that they could make it to the site with some assistance.
Both of the sites are wheelchair accessible?
Yes. Yes.
Okay, thank you.
Any additional questions from Blackburn?
I just wanted to clarify something, the criteria for going to Orange. You mentioned that to go to Orange, you need to have 40 or fewer cases per 100,000. You need to have a positivity rate of 2.5 or less, an RO of 1.2. And locally, we have, we're good on both of those, I think. We have an RO of 1.03, a positivity rate of 2.3. It's our case rate that's keeping us at red, just to clarify, correct?
That is correct, yes.
Okay, thank you very much.
Any additional questions from the Windsor Star?
No, thank you.
AMA 100?
Dr. Ahmed, Teresa touched on it. Monday is March, so this is our last call for the month of February. Just want to get your thoughts on the month. I'm just looking here at some numbers from last month. We had more than 4,300 cases and 170 people passed away. As of yesterday, we had 800 cases in February and 62 people passed away. Obviously, we made some progress. It's still unfortunate people are dying, but just want to get your thoughts on how we did this month.
Yeah, I think, Rob, you're ahead of me, and I don't have those breakdown by month to month, so I would assume that your number is whatever you're looking for is correct. So I cannot validate that, but yeah, no, I think the month of January and December was really hard on everyone, including our staff, who have been frantically trying to get to all these cases and to make sure that we're doing a good case and contact management to prevent the further transmission. So February is definitely a welcome month in terms of seeing that the cases are stabilizing. We still are not out of the wood yet, and I think just wanted to make sure that we continue to hammer this message that we still have a long way to go. COVID still exists in our community. There's still at least 1 in 5 cases that are acquired in our community that is that we don't have an appealing. So it is moving forward, and so we want to make sure that we have all these measures in place. And unfortunately, when people are dying, it makes it really hard. It's hard. Makes it hard for us. It makes it hard for the families and their loved ones. And we're really hoping that with more and more people vaccinated in our community that are at higher risk, we should be able to prevent that. The number of cases are going down. We should be able to see some positive signs and positive impact of saving these lives. So it's a good news, but again, we're still dealing with lots of cases at this time, and we'd like to see that number continue to go down. And we'd be more happy when we're not reporting any deaths. And it's unfortunate that every other day or every day we are reporting 1 or 2 deaths, and even 1 death is too many if we can prevent that death. So all our team and everyone's effort is to make sure that we are protecting those lives.
Thank you. I'm not sure if you have this number in front of you, or Teresa has a number in front of you in regards to the village at St. Clair. Like Taylor mentioned, it was rescinded. Do you have the number in front of you, what the final, I guess, staff members that tested positive and residents? If not, is there any way you can send that to us?
We can try to send that information to you later today, Rob.
Appreciate it. Have a good weekend.
Thank you.
Thank you, everyone.